Welcome to Peacebuilding Initiatives with José Barzola. Peacebuilding Initiatives are collaborative ways, efforts to cultivate healthy, positive relationships through dialogue, cross-cultural understanding, and the willingness to shift our own perspective in order to build compassion and empathy within our communities. Thank you for joining us today. In today's episode, I'm joined by Dr. Courtnee Nunokawa, a nurse practitioner, educator, a neurotherapist whose work bridges the worlds of clinical care, trauma healing, and neuroscience. Dr. Nunokawa serves as an instructor and the Doctor of Nursing Practice Program Director at the University of Hawaii at Manoa School of Nursing. She's also the founder of Balanced Brain, a Honolulu-based neurotherapy practice focused on brain health and trauma recovery. Her most recent project is helping to bring brain health to the community as a faculty member of nonprofit Brain Health Applied Research Institute. With a deep background in caring for veterans, particularly those living with PTSD and post-concussive symptoms, Dr. Nunokawa combines evidence-based medicine with integrative approaches like neurofeedback and biofeedback. Her research and clinical work explore how healing the brain can become a pathway to resilience, connection, and peace. Together, we'll explore the intersections of trauma healing and peace building, especially how understanding the nervous system and trauma responses can support individuals and communities in building more compassionate relationships. So we'll begin now. So thank you so much for joining us today.
Thank you
Um,
so much for having me.
yes, would it be, so Dr. Nunokawa or Courtney, you let me know which one you prefer.
Courtney is perfect.
Okay, wonderful. Could you share a little bit about your personal and professional journey and what led you to combine nursing, trauma care, and neurotherapy?
Yeah, so I think it really starts probably in my childhood, in my adolescent years. So my my paternal grandmother had Alzheimer's disease, and she lived with us for a bit, probably, I don't know, 3 or 4 years. And I had no kind of formal understanding of the brain and medicine and healthcare, but really was able to see kind of how witness her functional and cognitive decline, and truly how that impacted my parents' siblings, and my sister, myself, our immediate family members. And I think it sparked, without even kind of being really aware of it at that time, I think it sparked this understanding of this fragility and beauty of the human life, and it truly inspired me to go into nursing. So I kind of went a very traditional route, got my bachelor's in nursing. And while I was in school, actually, my bachelor's program, so bachelor's degrees in nursing, for people who don't know, is predominantly focused in acute care medicine. So the sickest individuals in the hospital. And while I enjoyed it, I enjoyed working with people. I really felt this. Um, it felt incomplete. Like I was seeing people for 3 or 4 days, they were going home. Some of them were coming back within my student rotation. So within a month, they were back in the hospital. The families, I saw the impact to the families and how difficult it was to see a loved one in the hospital. And I really, it sparked the seed of, I want to do more. I want to be more involved in people's lives, than just this 3 to 4 kind of day sprint that trying to get people better. And that's where after my bachelor's, started pursuing my nurse practitioner. So kind of traditional nursing route. Got my master's as an adult and geriatric primary care nurse practitioner. And the goal was really to shift my focus from that acute care medicine to population, community-based care, primary care. And as I transitioned to primary care, similar themes started coming up. So I have blood pressure goals that I'm working with people on, or heart disease kind of conditions, but I really align to, the whole person, so they're not taking their blood pressure meds because they're caregiving for their dying mother, or they have a child who has special units. So I started realizing they don't have a home to live in. And so how can they even prioritize their diabetes medications? So really started to recognize that health is so much more than a pill that we can give, or a little bit of a little bit of health education. It's this wrap around, how are you living and being with your community members? And that really led me to working in the VA system, the Veteran Affairs system, and predominantly working with individuals with kind of high what we call health disparities within, so high external factors that makes it hard for them to be healthy. So homeless populations, incarcerated individuals, or people kind of involved in the justice system in some way, shape, or form. And then specifically in the or in the veteran population, high rates of PTSD and traumatic brain injury. So really seeing how these multifactorial issues that people go through directly impact their health and well-being. And it was through that work that I not only was able to learn how to work with these individuals and how to help them, but in many ways became my own kind of spiritual journey on what humanity is and what human beings are, and what does fulfillment, joy, and happiness mean. And I aligned to it. I really enjoy the work, and yeah, that's how I landed in this space.
Thank you. Thank you. I love that, I think a lot of I'm always impressed by how much of our early youth impacts what we do later on in life, whether we see it or don't see it. But I think I can definitely see you taking lots of time to like reflect and uh, also finding that joy in your life, which I think is so key because many times folks may be motivated by, whether it's just money or it's just the job to get the funding to do what then brings them joy. So I commend you on kind of weaving it all together and constantly, I guess, trying to also not stay within the cookie cutterness of like, oh, I'm a nurse. I need to go work at a hospital and I need to just do this and constantly evolving. So thank you. Thank you for doing that. And now I know that you've worked extensively with veterans, especially those dealing with PTSD and brain injuries. How has that shaped your understanding of trauma and healing?
Yeah, I working with that. So I see the veteran population as one of the most resilient kind of populate groups of individuals. They're just from basic training, the things that veteran or service members are asked to do is very different than you and I kind of showing up and not putting our bodies on the line, our brains on the line. And kind of really it's a full body commitment that they're making for their country. And then for those, I work predominantly with Vietnam veterans, so the kind of that aging veteran cohort, and then OEF and OND, OEF, OIF, OND, so Operation Active Freedom and Operation Enduring Freedom, Operation New Dawn, so that they were younger individuals. So, and they met, in some cases they were my peers as far as age group. And really what they experience is something that many of us won't experience in their lifetime. And it taught me a lot about resilience. So the fact that I think oftentimes veterans, and especially for our Vietnam veterans, were kind of disregarded when they returned home from Vietnam. And there's a lot of conflict at that time in belief systems. And they were able to kind of rebuild their lives, get work, have families. It takes a lot of resilience to come back from kind of essentially kind of being in this like conflict mindset to returning to society, finding joy, meaning, purpose, in things that, when you're in the service, your main goal is to protect the country. That's like the first and most important thing. And so to come back and say, prioritize your kids again, prioritize life again, I see that as an act of resilience, that they're able to kind of shift those states. And that's where I think for me, it was almost spiritual working with that group of, it's almost like, how can you push the human form to its peak capacity and also still be able to come back and enjoy and live. Yeah.
Oh, thank you. Thank you so much. Um, how do you see trauma, especially unaddressed trauma? We there's different factors and services we have available for folks, but I always find that we're constantly learning of new types of trauma, unfortunately. So how do you see it affecting our ability to connect, communicate, build peace?
Yeah. Yeah. So there's like the clinical term of trauma, and there's big T trauma that we think of, like the big major like car accident or going to war, this big event that causes a lot of turmoil and feelings of unsafety within us. And then there's little t trauma. So going back to your thoughts on childhood, even living in a neighborhood that feels unsafe and you're worried about every day someone coming in and trying to rob you, that lack of sense of safety over time can manifest as trauma. And I think the where we really categorize clinically like what trauma is the inability to integrate that story into our life is kind of how I see it. So it's this major event and it's still coming up as the stressor. Our body is still living in we're still responding in a way that we feel fear, like we have to run away from the lion, hide from the lion. And when we don't have a sense of safety, it makes it our our judgment, or the lens of the world we look through has a lens of a little bit of a dark cloud, which makes us more, and it manifests for different people. It could be avoidance, right? So I'm not able to connect to others because the world is too scary. Why would I go to Costco? There's all these dangerous threats there. So I avoid. Or I'm looking at the lens and I'm assessing situations as maybe they're unsafe, but it's through that trauma lens. And in reality, this person's really just trying to have a vulnerable conversation with me, but it's landing as a threat. So trauma that's kind of lived and still living in the body really impacts our ability to assess the world as a safe place. And if we can't find safety, it makes it really hard to try new things, to meet new people, to connect in communities, etc. Yeah.
No, thank you so much. Kind of going along that conversation, I wonder if you might share, for communities facing deep divisions or collective trauma, where can healing begin? You know, is it just initially reaching out to a professional? Just wondering
Yeah.
in your expertise, what you'd suggest.
Yeah, I mean, definitely if you want support, which we're working with a professional is always helpful. Um, I think we're in a pretty tumultuous time in the United States. There's conflict on both ends. I mean, there's conflict globally as well, but I think in our lived home, we're seeing more conflict, either violence-wise or philosophical kind of arguments. Um, so this is kind of an existential answer, and then if we want, we can get into more
Yeah,
nitty-gritty
yeah, no, no, I
things.
love it. Thank you.
Okay, but I really believe, so I'm trained in mindfulness-based stress reduction, which is predominantly based on the Buddhist practices. And something that really resonates with me from mindfulness-based kind of approach is the core tenet that all humans suffer. So suffering is part of the human experience. And I think sometimes we forget that other people are suffering, right? It's we get stuck in our own, like, I'm not happy. I wish the world was this way. I wish, whatever reason I'm suffering. So I need to change these other factors. And then we forget that the other person is also suffering. So I think truly at least from our country standpoint, if we can take a break and a pause and just say, like, what is my needs in this moment? Like, what is my real ask? It's not about this belief system. It's not about, what do I actually need to feel safe again? And what would make the other person feel safe, or the other side? Like, what is their needs? And can we find some common ground where we can both get our needs met? Maybe we don't agree on what those needs are. Like, maybe, you want an apple and I want a banana. And I think apples are just the worst fruit in the world, but I honor your need to have that apple and I can have my banana, and we can coexist in a way that we're honoring each other's all, like, truly what we're looking for as human beings is to have our needs met, to find happiness and joy. So going back to the core premise of, like, we are all humans, we're all trying to live this life in a way that feels good, feels aligned, feels connected. And I don't have to take away someone's happiness or needs in order to keep my needs. So that's kind of my existential answer.
I love that. Thank you so much. No, it reminds me a lot of thinking about perspectives and that's the thing as we get delve into what our needs and the wants are, sometimes we forget that, there is a whole community of folks and people have different needs and wants. And so and exploring those I think is ever so essential. Yeah, I always talk about, the lack of conversation, I think, is potentially what leads to it even more. So because we get so stuck on, and sometimes that can be a result of trauma. We just whether we don't feel safe, we just whether it's to engage with people, we're like, well, this routine that I have is working for me on a daily basis. I just leave. Maybe I just step out to get some groceries certain days of the week, this time. I avoid people, but that in itself,
Totally. And I think even when you look at oppressed groups, right? Like, am I going to come out and trust the world again when it was really kind of rough generationally? So then I think, like, how do we create safety for all? Yeah. So,
yeah, yeah, no, most definitely. And there is a culture of, I mean, I think people are saying it left and right. Like there's a culture of fear that's can that I mean, there's always a culture of fear, but the culture of fear, I feel like, is growing to many parties. And so, yeah, just having to like second guess, like, is it okay to go to this place? Or maybe we should consider a different place.
really.
Yeah.
Yeah, and a tiny, like just a neuroscience kind of segue. I think
Yeah.
there's like behavior change is huge. Like, how do you generate behavior change?
Yeah.
Um, and I think you and I are like, as you're saying, we're aligned in like, let's kind of show up in a collaborative way and a discussion oriented way. But fear is a very effective motivator for if you look at young kids and if you're going to fall off the playground, they'll maybe come down. I don't know. My son might still go, but fear is a motivator, and so it's hard to
Yeah.
navigate a system where people are kind of capitalizing on that.
It's funny you give that example. I just thought about like, but then there's also like the courage of like that seems like really fun. I think I do want to, I don't want to
Yeah,
walk up the stairs. I want to walk up the slide.
yes, definitely.
So, so yeah, no. Well, shifting a little to neuroscience, you work with neurofeedback and biofeedback tools. I know not everyone may be familiar with. Can you explain what they are and how they support healing?
Yeah. So, I mean, before I get into kind of what they are, I just kind of a
Yeah.
segue from the trauma. Um, I didn't mention this earlier, so I want to kind of add it in. Trauma
Thank you.
really is whole body experience. So people often think of trauma as thoughts or nightmares, but truly some people live and feel their trauma in their bodies. So it may present as my heart rate is not controlled and it goes all over the place when I get fearful or scared, or I hold a lot of tension in certain areas of my body. And every time I get stressed, my neck becomes sore. So I think each of the trauma therapies are trying to access the nervous system or the brain or that core sense of self in different ways to help the body and mind process it out. And neurofeedback, biofeedback is something that I really enjoy using as tools as a clinician. So biofeedback is kind of the umbrella term. It's anytime you're using your own objective body metrics to help make choices and changes. So the Apple Watch, like the wearables that we're using now, so Apple Watches, Fitbits, those are all forms of biofeedback, right? Like I see my step count is only at 2,000. My goal is 5,000. It's 4 o'clock. Let me go run around the office for a little bit. So that's a form of biofeedback. In the clinical setting, we get kind of into your like heart rate, your respiratory rate. We can even measure your muscle intensity. So if I'm talking about something and I notice your traps are getting more tight, I can give you that feedback, and then maybe let's process that information in our body a little bit differently. Neurofeedback is a form of biofeedback that uses your brain waves. So it records through electrical impulses of your brain through EEG. We record your active brain waves in real time, and then we feed it back to you. And it's really a form of operant conditioning. So if you think about for like Psych 101, Pavlov's dog, if you have a treat and a bell and you ring the bell and give them the treat, over time, if you remove the treat and you ring the bell, the dog associated, there's going to be a treat. So I'm going to start salivating and it's an enjoyable thing. So neurofeedback, we're rewarding certain states and it's really kind of dependent on each person, but we're rewarding certain states like relaxation, maybe kind of we're trying to increase and not relax and increase your attention span and your focus. Or something that we work on is this concept of coherence. So that can your brain work together synergistically? And so through that, I see it really as brain exercise. So you're kind of allowing your brain to drop into this state. We never get to see our brain. It's like one of the, we don't get to see a lot of our organs, but we can do colonoscopies and different things to look at our gut and then different organs, but we never get to truly see our brain work in real time. So it gives the brain this opportunity to see itself and optimize. Yeah.
No, thank you. Thank you so much. And so how does healing at the individual neurological level ripple out to affect families or communities or the systems?
Mhm. I truly believe the brain, it is our master center of our whole body, mind, spirit. And so we haven't, we're starting to now. We're definitely seeing it more, especially in the clinical space. And for those of you who want to kind of look at research studies, there's a recent Pointer study that was just published in 2025, highlighting lifestyle choices and the impacts for the brain. But otherwise, we don't really look at the brain as something like we look at our biceps and we're like, okay, let me like work my biceps out and make it stronger. But we don't kind of think about every day, like, how do I make my brain stronger? But when we make our brain stronger, we are, our thoughts become more aligned with who we are. We have less kind of mood symptoms that can happen. Our body works more efficiently. So we actually digest food better. We perceive the sensory world better. And so I see it as we're just allowing ourselves to operate at our peak and highest self. And when you remove all the like gunk that we have to deal, like the tiredness and the drowsiness or the brain fog or the stomach pain that's caused by some functional kind of brain disorder, the brain is able to be clear and we're able to make decisions from that clear highest self. And truly, I think when you are operating from your highest self, where we want to be more connected, we go back to kind of this purpose-driven life, and we want to connect to people, we want to connect to communities, we feel safe enough to connect to others. We are speaking in ways where we're truly aligned, right? We're not taught like we're not worried about our pain in our stomach and while we're having conversations with people. So I think by optimizing the brain, you're allowing yourself to live in the world and in truly your highest and most peak self, which then ripples on to more meaningful connections and engagement with community, wanting to give back, wanting to improve the world we live in.
No, thank you. You just got me thinking about how like what is it? They recommend going to the dentist like twice a year. You get your annual physical. When do we get a checkup on our brain? Do we just assume that because people are going to school that they're but you know engaging in their brain? Like I just
Totally. Yeah, it's very reactive. I mean,
yeah.
it's where there's a problem and we're trying to solve the problem and then we look at the brain and I mean in some cases self-included depression, for example, we will prescribe medications for depression, anxiety without ever looking at the brain in many
Yeah.
cases. And we commonly don't do that with other organs, right? Like if we're worried about the heart, we have many different imaging modalities and ways to assess
Right.
electrophysiology modalities. Um, yeah, and then going back to kind of the prevention piece, I what I think is funny is we tell people we're very cardiovascularly educated as a society, right? Like I think people know, like get on the treadmill, you go for a
Yeah.
30-minute run, your heart will get better and it'll work better and longer. The same concept is there for the brain, right? If you work the brain out, you challenge the brain, like me showing up here and like being a little out of my comfort zone, hopefully will grow my brain a little bit. And that's the concept of neuroplasticity, which is kind of a buzzword now, the ability for the brain to actually grow itself and make new connections.
So, multiple questions, but how often would you recommend like a check-in on your brain health?
Yeah, that's a very interesting. So I think there's different ways to assess. I think so. Everyone at home right now, I think one of the best ways to assess the brain is self-awareness, which
Mm,
sounds silly, but the more we can identify, like if we can identify this is my highest self, or I use like a life wheel. So assess your life in all these different areas, finances, family, work, student, whatever your kind of roles, your different buckets are, assess where you are. And anytime there's a gap, right? Like if you're like family is my number one most important thing, but for whatever reason there's a gap, I'm not putting as much, it doesn't align to my time. Then we can start asking ourselves questions of why am I living this life? Like why am I making choice? Like why is my brain living a life and making choices that isn't actually aligned to who I am? So I think that's kind of the first self-assessment. And then from there, I think that's where it becomes like, how do we bring the support? So I guess there's different ways to assess the brain.
Okay,
Um,
no, thank you.
yeah,
I guess maybe this kind of lead into the question I did have. Are there ways that everyday people without clinical training can apply basic brain health or resilience practices in community settings?
yeah, yeah. I think one thing like exercise for the brain. So I guess going back to the pointer study, that there's like we know many of the things that are good for our heart are also good for our brain. So eating a good diet, exercising is really, really good. And it's there's actual kind of hormones that we get released that get sent up to the brain, crosses the blood-brain barrier. So exercise is truly almost like a fertilizer for the brain. Good sleep is really important. And then if you're having problems in any of these areas, so sleep is a big one. I think 50% of our country has some type of sleep problem. Engaging someone to help with sleep, social connections. So we are actually strengthening our brain when we're having conversations like this. I mean, I have to, it's work for my brain to kind of be empathetic and then see your facial expressions integrated into my brain, figure out what I'm going to say next. It's a very highly dynamic process. And also the unmeasurable is we are human beings and evolutionarily we are supported by social aspects. And then avoiding risky substances is a big one. That's like the punitive one of avoiding alcohol, illicit substances and things that can actually hurt our brain. And then I think there's, so once you kind of get that core lifestyle, like you're eating pretty well, you're exercising, then I think it becomes how do we introduce novel challenges to the brain? And so historically people would say like, oh, prevent dementia by doing crossword puzzles or like just go for a walk and like take a different route. But really, we're recognizing in order for that neuroplasticity to happen, for the brain to become stronger and more connected, we need novelty and challenge. So something that's kind of new. So if you do go for a walk and it's a flat surface, walking, and that's been your path for 20 years, then maybe take a different route and add a hill. So that challenge in and of itself will challenge the brain to be like, oh, I have to make a new neural connection because I've never done this before, and I have different flooring under my feet, and I have to accommodate for that. Yeah, so it's novel and new challenges is a big kind of piece in building brain health.
It's I love that because it reminds me about sometimes I talk about how I notice in human nature we love our comfort, we love our routines, and
Mhm.
and you just shared that we actually need to change up those routines to help out our own brain health is what I'm hearing, and and it kind of leads to the whole like conversation about leaning into your discomfort, exploring new experiences that we talk about. So. Okay. So I guess I love that the correlation now that I'm finding between brain health and some of the work that, we just have done in many ways. And I mean, I find that these are kind of like philosophies that I have in the work that I do because it's also I've just been used to like having to pivot a lot. And so
Mhm.
um to
And
have a
being open. Yeah.
yeah, yeah, and to find like a schedule or some kind of routine is maybe that's not what we need to do. We just need to make
I will say there is some we do like safety, and I think safety
yes,
is like we need to have these novel challenges and also be able to come back down and like relax and restore.
yes,
And I think that is because sometimes we're too like novel seeking and we're not getting enough rest and restoration.
yes.
So I don't, yeah, it's not the it's You don't have to like change your brushing teeth
It's
time or
it's
your
all
morning
about a
coffee.
balance. That's what I'm hearing.
Yeah, we like those routines too.
Wonderful. Um, Now, I know you've done the work on aging and intergenerational care. How can honoring the wisdom of elders be a part of community healing and peace building?
Yeah, I was so I have predominantly worked with the older adult population. And they are I have a natural affinity towards this, so I'm like coming with personal bias for sure. Um, but I think I was really pondering this question, and I think the like what I gain just personally out of working with older adults is their lived experience. And there's so much in the human life that's unmeasurable. You know, like we know what's good for your brain, like don't drink alcohol and don't, but then you meet the 105-year-old older woman who like has wine for the last 40 years and she like loves her great grandkid, you know, like you're like, okay, there's a mismatch here. There's something more. And I really think in this time of especially like AI, as we're kind of like group thinking it's becoming more and more because we have these learned language models and et cetera. Um, I think the older generation and that lived experience is truly going to become more and more valuable because that's what makes us human. We are not learned language models. We are very something that we talk about with the older adult population is they're very they're mixed, right? Like when we have a 1 year old, two 1 year olds, you kind of like can anticipate they're going to start walking at the same time. Maybe they're going to start verbalizing. You know, there's like a 6 to 8 month window. But after people become adults, you know, your 30s, 40, you have different life paths, you make different choices, and you can see those lived experiences compound over time. And I think there's a lot of value to that that we don't capitalize on. I mean, there's so much that cohort can teach us and how they live their life. Um, and I think I think a big part of like my personal beliefs and trying to pivot is ageism, right? Like that this group has lost their productivity time. And so they're kind of, we just have to age them out and let them live. It's like, how do we engage them back into our society and allow them to inform decisions and how we're approaching problems through that perspective, especially since knowledge, like just kind of textbook knowledge will become so easily accessible.
I wouldn't consider that any kind of bias. I think I'm on the same page as you. I mean, I think it's ever so essential to create space for our elder populations for those voices. Because going back to you brought in AI into the conversation. I just look at it as like, oh, it's like a textbook. It's, what used to be like the encyclopedia you go to the library for. It's a very cookie cutter answer that's been conditioned by, I mean, in this case, obviously by various voices, but it's not all inclusive of all voices. Um, and as we know, as you brought up the Vietnam War, and so we learn about history through those who win, those who survive, and rarely do we hear from those that didn't get a chance to get interviewed and get their stories recorded. And I think that's something that the elderly have to share with us, the stories of every day. And so I sometimes I thought about, you're talking about, their 45 years of drinking wine, like, but I'm also going to think like their habits of like what they eat and it's probably a little bit less um hopefully less extra, processed food. But then again, you meet somewhere like, wait, you've been doing cup of ramen for like 50 years and you're still, what's going on
Get much
here?
better socialization, you
Yeah.
know? Yeah, no. Yeah, it's like the world, we humans are so nuanced that we
Yeah.
can't be just boxed into like knowledge. And I think when you work with older adults, you see like there's a 72-year-old running an ultra marathon and a 72-year-old who is
Yeah.
it's like fascinating how
Yeah. And yeah, and I think that's something that kind of that resonates that I've been uh hearing and talking about a lot lately. It's, there is no cookie cutter format, but I know within the society we're in, how do we service so many if we don't find some cookie cutter platforms, I guess, to assess folks? I always think about, there's like what is it, assessing like, oh, there's a certain weight status you should have depending upon your age and your height, but never takes into consideration like culture or genetics. And so, yeah, and I wonder, like within brain health, is there are there any standards, or you just kind of, because even as you're trying to learn about the brain, you're learning about that one person's brain, not
Right.
yeah.
Yeah, no, I have many thoughts, but I think much of my formulations of who I am in many ways is the privilege of working with so many other people. And so it's like I've had this expanded perspective and perception on the brain and on multiple different brains and how it plays out. And then also to your point of, so the way that I practice is a little different than traditional primary care. So I'm able to, the way that I design my practice, I have more time to spend with people, to ask them these nuanced
Mm,
questions and to honor the cultural values or whatever values they have. I think we all have our own compass that we're trying to live on. And when we're in alignment with or when we're in alignment with that compass, I really believe that's when we feel fulfilled. And that's actually like health will naturally flow versus chasing it. But I do like something that, so when I left kind of a larger system like the VA, which is more of a population system where they're capable of treating the masses, I guess, mass numbers. There was a little bit of am I losing, like, am I almost abandoning like thousands, like when I can treat thousands, but
mhm,
now I'm reducing it to hundreds. So that's definitely like an internal thought that I have. But what I think is it's what I see medicine moving towards, especially as information becomes more available, is instead of your doctor, your primary care doctor, your cardiologist being kind of the all-knowing paternalistic figure in your life, it's like this is one piece of my playbook. And how can I build out my playbook? Like, how can I evaluate what social meaning means to me? How can I evaluate what health even means, right? Like, I don't, if my BMI is 32, but I'm happy and I love everything that I do, who am I as this healthcare provider here to judge what your goals are? And so I think over time, I hope that people will become more empowered to look at their own lives in a way where they can take the information from their healthcare provider and integrate it versus it being the only piece of knowledge
mhm.
of their health. If that makes sense.
Yeah, no, thank you. No, that it does. You just shared a little bit about having to leave 1,000 to 100, and one thing that crossed my mind, was there any kind of frustration or guilt trip? I can only imagine the various levels of emotions that you may have gone through, and I just wonder for folks who are part of a larger system who may be going, listening, and thinking, also observing and being like, no, it doesn't have to be done this way. And I think one of the other key things you talked about is like time. Time is
Mhm.
truly precious and priceless. And being able to devote that extra time is so key to the human, the whole. And in a lot of our practices, it's like, oh no, you get 30 minutes, 20 minutes, 15 minutes, 10 minutes. It's like, so I guess if you have any words of wisdom to folks who might be considering transitioning, and yeah, just any things that might have assisted you in your own transition to um, starting your own business, to being like, oh no, we need to be giving more time to folks and just
Mhm.
doing what's right, I guess, for the community as a whole.
Yeah, I mean, so for the people who are still in the system, I think advocating within the system for change is always important. It's like, how do we, so in the VA, I was able to pivot a little. So we started doing groups, so
Mhm.
group-based care. So you can see 12 people and kind of dive into topics, you're capitalizing on time, which is this limiting asset that we all have. But I think for me, transitioning out was a truly like a alignment in my personal and professional self. So it was a very personal decision. And it was me kind of looking at how do I best want to serve others? Because that's really important to me, but also how do I do it in a way where it's sustainable? Because what we're seeing now in the healthcare world is people kind of entering the field for 5 to 10 years and actually burning out and leaving. And I was, that I was in that space a little bit after COVID and kind of can I sustain, can I, when I started feeling like my quality of my individual care was sacrificing because of these external factors, and there's nothing like nothing against the VA at all, but it's just the structures of certain kind of modalities. Um, that's when I said I personally have to kind of make a pivot that feels more aligned with my life. And having young children was a part of that decision. Time that work-life balance was part of that decision. My family was a big part of that decision. So yeah, my hope and burnout is something I think about often. So for healthcare providers out there, it's the same like self-assessment. It's like am I lining up and aligned, and where am I not lining up and aligned? And for me, I was not aligned to my work-life balance and my family values. And so I pivoted. Yeah.
No, thank you. Thank you so much. Yeah, and I think rarely do you hear about I mean, you hear about the stress in the healthcare system, but rarely people talk about the burnout, or the people that have experienced it, just they're physically burnt out, so they don't want to talk about it. And there is, I mean, yeah, it's well, I think overall the message that I'm hearing is, you got to assess your life as a whole. It's not just the job, and hopefully the job should not just be your full entity of life. What else do you have on, that you're balancing in life, and are you truly finding joy in what you do, whether, you're at work or not at work? So, no, thank you. Thank you for that. Um, so, what insights have you gained from working across the lifespan, from youth to older adults, about resilience and reconciliation?
Yeah. I think innately human beings are resilient. And I think that's an evolutionary thing. I think our innate response is to want to be resilient, want to overcome, and want to succeed in many ways. And we want that for others. But sometimes I think so. If you look at like when I look at it across the lifespan, I think of older adults and really young kids as actually the most resilient groups. And this is just anecdotal and my own personal preference. I haven't like looked at the literature on this. But I do wonder how much just adulthood in and of itself, like when you're diving, you're starting your career in your 20s or 30s, and you're like really in it, you're raising a family in your 30s and 40s, and you're just kind of in this societal, like you're actively participating and engaging in society. How much one, it's just really stressful times to be managing, marriages, children, work, etc. Like, so it's like we're truly taking out of the cup a little bit. Um, but yeah, I going back to like finding who we are. I wonder how much we miss. We're not aligned, and therefore our resilience is lower in adulthood. And that's something that I see kind of working with clients is we're living a life, we're going to a job, we're kind of doing things that don't feel aligned. And so we're actually taking out of our cup every day. It's like, oh, I'm going to choose to, I don't know, scroll on my phone instead of going to the gym. Took like 10 points out of my resilience cup. Then I go to a job that I've like complained about for the last 4 years, more out of my resilience cup. And then, so yeah, I think we get kind of that adult phase, we sometimes lose sight of like what will actually be put into the cup. And I think kids are really good at being like, this is what I need. I'm gonna cry and scream if I need it. I need it. I'm not gonna suppress it down because this is my need. And then older adults have the perspective and wisdom to say like, hey, leave that there, and this is what I want and desire. Um, yeah, so I think we can learn from those two groups a little bit.
So funny. Thank you. It just confirms my thoughts on, like, as I also having young kids, and I observe, and I'm like, life is really, they say what they want, what they don't want. And I feel as though as we get older, we just make life more complicated. And maybe it's that whole, like, oh, I need to go have a job. I need what do we put on our plates, I guess.
You know, it's
It's
My 5-year-old can have like a full meltdown, right? Like in the grocery store. And then 10 minutes later, he's like running, having the time of his life. Like I see that as resilience, right? Like had this big stressor, was able to come down from it, very quickly return to joy and happiness. For me, it's like I do bad in a meeting, I then go beat myself up for the next 3 days about how poorly, it's
Well,
like
I think part of it's also like social norms. It's okay for your 5-year-old to have a breakdown in the grocery store. How often are we as adults allowed to have a breakdown at a grocery store without like someone being like, do we need to call a mental health provider or call the police? Like, like the social norms of what's allowed or not allowed as adults, I think is unfortunate. But yeah, there is I sometimes tell folks I'm like, coping strategies. I was like, if you need to cry, just do it, like obviously within the context of like whoever you are. But because there are folks that I meet that they're like, oh, I haven't cried in like years because they're so
yeah,
conditioned and maybe that leads goes back to like the trauma conversation of
it does.
what's expected.
Totally. Yeah, I mean, what's coming up as you're speaking is like we need compassion for each other, right? Like we need to
Yeah.
hold space for people to build their resilience back up when their resilience is low. Yeah,
I think part of it, it's like we get conditioned into structure, whether it's capitalism, business, whatever you want to call it. And I was just thinking, like, we we go through schooling, so there's a syllabus and there's like guidelines on how to succeed in this class. You go through a job, it tells you, oh, okay, there's a job description you apply to, so okay, you kind of have an idea of how to succeed in that job, but you get married. Maybe there's a couple books if you look out there, you listen to some podcasts. Kids also, yeah, you can like read the books, but obviously the books aren't going to tell you everything, just like with marriage. Um, so yeah, there is no syllabus or job description on how to succeed in those. And many times we just figure it out with hopefully we've been provided some good tools to the toolkit or some skill sets along the way of our growing up to figure it out. Yeah, it's
yeah,
quirky
and
thing called life.
totally 100. And to your point, I think success is so individualized. Like what success is to one person looks totally different to the other, and that's what's hard because we also are we compare ourselves to other people, and we think,
Yeah.
oh, should I don't know, have that thing or have that job, or should I try to get promoted, or all these comparisons. One like plug for trauma that I think is this is like making me think about is we also label trauma. Like we don't label it trauma, we label it as substance abuse. We label it as
Mm.
like schizoaffective disorder and with avoidance, or we label it as anger. And I think, when we pull back those labels and we kind of dig deeper, that's where we can really allow for compassion and space and healing.
That reminds me of a previous question that I had in your experience, what are some common misconceptions about trauma, its impact on communities?
Yeah, I think that is the labeling piece is probably one of the biggest. We like
Mm.
to put people in a box, right? So to the point of
Yeah.
like you go to school, you get a job, you are now a professor or you're now a doctor, whatever kind of label it is. I think we similarly do that to trauma. And we label it as the behaviors that they're presenting as. So they get labeled as, not contributing to society or unemployed or an alcoholic, and we aren't able to pull back the onion a little bit and look a little bit deeper, and it's like this is he's unemployed because every time he tries to get a job he's fully triggered and he can't interact with, like he doesn't have the social and emotional skills to work in a fast-paced dynamic environment with 50 other people. I think that's where, yeah, allowing that space sometimes to be trauma informed, to say like, hey, this human is suffering, can there be a deeper narrative than just kind of immediately labeling them? Yeah.
Well, thank you. And speaking of trauma informed, what does it mean to bring at least like a trauma informed lens to like a peace building effort? Might you provide an example of what that might look like in practice?
Yeah, I think in clinical practice, it to me, it is the awareness that, and I use this term just because it's my term, but it's awareness that we are all suffering. So the person coming in for a broken knee who is being kind of combative or isn't giving you is withdrawn and not giving you information, but you're like, hey, that's, like we're talking about your knee, it's not a big deal. Is would be kind of a bias that could come up. So it's this empathy of I don't know what they're experiencing, and then also a self-awareness on checking the biases. So we all have perceptual biases. I may like when someone's late, like late is something for me that I'm biased. I'm less forgiving on lateness than I am on other things. But we all have our own kind of little micro triggers. And so the more we can check those and just say, how can I hold the space for this person in this moment? Um, can allow for a lot of healing. And I think in a boardroom setting, right? It's like actually setting up the meeting in a way where maybe it's let's not engage in a discussion. Let's just put everything out on the table, like get all the needs out on the table, get all the frustrations on the table, allow for space. Like let's honor that whatever that guck is for a moment before we go into, and this is how I think we should solve it. This is how I think you should change. This is how I think we're yeah. Trauma inform is allowing that space before we jump in.
No, thank you. And just want to resonate some of the things that I think that really stood out to me. Talking about the triggers, we don't know what are the triggers. Well, one, I hope folks make time to figure out what are their own triggers. That would be ever so essential so as they navigate life and help dealing with some of that trauma. But I feel as though, we don't know what perspective folks are coming from. We don't know what we may say or do, uh, even non-verbally, that might cause that trigger. And also, two other keywords that I really love to hear is compassion and empathy that you talked about earlier, which are ever so needed. And sadly, not actively, when I always ask folks, like, when's the last time that your superior, your boss talked about compassion and empathy, creating space for that. It's more of like, oh, there are projects and things that need to get accomplished. Um, this is a deadline. If you have questions, let me know. Maybe they'll even say, sometimes they don't even say that. They just assume that you were hired for this job, so you should be able to get it done. Um, but yeah, it's in previous conversations I've had with other folks who delve into this world of dealing with other people's conflicts as mediators or facilitators. That's the thing that keeps coming up, like the lack of empathy in a lot of conflicts that arise. It's just
Yeah.
no one's
Yeah, I
being.
mean, if you look at like the keyboard warriors online on social media, it's the reaction is to form an opinion or to attack or to disagree or to, that you don't really, you never see a comment of like, huh, interesting fact, let me go ponder that, or interesting perspective, let me
The
think about
commentaries, yes.
it. I mean, those people are probably not commenting in general, maybe anyway,
Yeah.
but passionately kind of driven in that moment. But yeah, yeah.
Yeah, it's unfortunate how these like algorithms, I guess, work because that's what gets those clicks, something that incites emotions, I guess, in people.
Yeah.
So what gives you hope in your work? Are there moments or stories that continue to inspire you?
Yes, I think I love to work with people individually, and anytime people make kind of big shifts, that is a huge rewarding motivator to me. Um, I think, yeah, I think altruism always feels good to some extent when you're helping others, and you can watch them succeed. Um, but I also think kind of broadly, I think my hope is that we're going through a high conflict period and we're figuring out and there's so many confounding factors, right? Like definitely like the political environment, the landscape on both sides and kind of the conversation, but also like we're still new to social media, we're still new to AI, we're still new to how, we can meet online and we're not meeting in person. Like we've kind of technology has really rapidly changed how we live and be as human beings. And I think this kind of low point is getting us to reflect and like, okay, this is really, at least for me, and circles kind of that it's like not working, right? Like this, like just kind of like talking over each other is not working. And so how do we're seeing more kind of solution oriented things instilled in different areas. And a direct example of this is my daughter's school after school has a DOE public school, has after school programs. And this year they included Mindful Monkey. So it's led by a social worker. But it was, so they have like she does art, she does some dance, but the fact that we're integrating mindfulness and developing cognitive skills at a younger age, cognitive, emotional, intelligence skills at a younger age gives me hope that, and people like you who have young kids and are shaping those minds. My hope is that the next generation or, our current generations will really pivot the philosophy of how society is to a healthier and more collaborative space. So I'm still very hopeful for that.
I thank you, thank you. I completely agree. It's I always find that amusing how as parents, I think there's this you want to do better for your kids than what you had. You want them to achieve milestones. And I recall when it's a brief story, like my oldest started reading at like 5 years and some weeks or something and or a couple days. And then like I went to like my parents, I was like, when did I start reading? They're like, not that early. I was like, thank you. Like wonderful. They're already doing better than I am. So yeah.
Totally.
Like keep at
He'll,
it.
he'll be leading like the World Peace Seminar in 10 years at the age of 15.
Well, no, it's just fascinating because, like, I recall when I was like, I think, I mean, I don't know if it's six is a year, but I remember when I was six, seven, like, I was just like a sponge. I could like retain information so much better, pick it up, and it
Yeah.
is so much harder as you get older. And I don't know if that's related to like brain health or not. Maybe I'm not working the brain enough. Maybe there's too many things I'm juggling. Um, but yeah, and then I look at my kids at that age and I'm like, wow, they're just balancing things so well and being able to like pivot from one topic to the next and the memory on that is just like fascinating.
I know. I know. Now they're like bringing up they're like, remember when we did that? And I'm like, actually, I don't remember when we did that,
Or
but I think
remember when you said this to me? And it's like, oh yes. Oh
yeah, my attention was a little, yeah. Yeah, I mean, that is a brain development thing. The brain is not fully developed till 25, and in that period, it is
oh
highly neuroplastic and is truly a sponge and just taking in so much information. Yeah, so
it's
I
too
think when
late
you're
for
laying
us.
out, no, but we can emulate that and through different
Yes,
exercises.
yes.
But I think you're laying the foundation of a way to look at the world that's yeah, peace building. And so they're going to
Thank
be
you.
these little seeds.
But yeah, no, I mean, incorporating mindfulness is ever so key, whether it's yoga, whether it's, um, the technology will be there. And I have no concern that they're going to be able to pick it up really quick once they get into it. But it's interesting because you mentioned social media. I think social media has actually been around for about like 2 decades or so now, but it keeps evolving, right? So there's always some new platform, some new format, something that's going on. But I will say lately I heard one of the latest things that youth are doing because they don't want to be, it used to be like the Facebook and now it's like, oh no, that's for like older generations. It's not for young generations. I
Yeah,
hear that folks are actually some young folks are there's a trend of like just not having anything online and not even having a smartphone and going back to like a landline.
I love it. Actually, I think I did see, it was like yeah, on social media when I was scrolling. I think I
Yeah.
saw it
Yeah.
like buying landlines and I went, oh my gosh, I love it.
Yeah.
That's
And
like my
so and as I'm thinking about like how to introduce a phone to my child, I was like, I also learned that there's a group of families that like they'll get landlines and so they can only call each other basically. So because there's all these skill sets that you learn, whether it's, oh, like so and so's parent picked up, like how do you speak, that having to shift to, I was like, oh, good afternoon,
Yeah.
or Mr. So and so or Mrs. So and so, like all these social skills that you don't get if you just have a direct number to somebody, or you can just text them per se. So,
No, 100%. It's like there's like this risk taking. I'm calling this number. I don't know if my crush is going to answer, or
oh,
I wasn't
that's
allowed
on
to
a
call
whole
boys
other level
actually.
if it's the crush. Yeah. And it's like, why do you want to
You know,
talk to my daughter? What is your intention?
exactly. There's like risk taking. There's intergenerational
Yes.
interaction. So I'm talking to someone who's
Yeah.
older and respect, and yeah, I think that's a great idea, and I will definitely be checking.
Explore that. Yes. So, for listeners, just wonder if there's any takeaways, a message from today's conversation that what would you want it to be?
Yeah, I think just kind of reflecting on the theme of this, I think really what's coming for me and what's top of mind is that self-reflection piece is I
Mm,
ask everyone to like just examine your own life and see because your brain is controlling all of it. It's controlling your mood, your sleep, your decision to go to school, your decision to work out, and just examine, is your brain operating in a way that's truly aligned with what you want? Because oftentimes we, self included, are doing things on autopilot in patterns that we actually is inconsistent with what we want. And then try to make alignments to who you are, who you want to be. And that's where I think really the support systems come in and the assessments, right? Like if there's something wrong with your sleep specifically, I definitely think like go work it up, get a sleep. So there's all sorts of options for kind of
yeah.
assessing the sleep. But that's when you bring in the support system so that we can potentially help you figure out how to get to that peak performance goal. Yeah.
No, thank you. Yes, self-reflection. Yes, we haven't talked about that yet, but yeah, no, most definitely. I think it's funny because in the classes that I teach, I always a certain percentage of the grade is like writing reflection papers or journaling, and
Mhm.
a lot of the feedback I get is like either like I didn't know how important this was, or I understand how important this was, but because I needed to do it because I was getting graded on it, I actually made time for it. Otherwise, we don't have time for it sometimes, unfortunately.
Yeah.
So it's ever so
Yeah.
essential.
We live in
I'll, oh, go ahead, go ahead. Sorry.
we just from like a brain, we like there's the executive control network. That's our like do reach goals, get tasks done. And I think society really rewards that, right? Like you get it, you get an A, you get rewarded in school, you go and get your first job, you get rewarded. Like we're a task-oriented reward system. And then you have your default mode, which is your daydreamer, your kind of self-reflection, introspection. And the goal is actually to have those be balanced, right? Like part of the day I'm executing, part of the day I'm introspective and self-reflecting, but we lose that introspection and self-reflection. And in many ways in childhood, like it's punitive, right? Like you're daydreaming in class, like stop daydreaming, go back to the executive and produce.
Yeah.
So it seems soft skills, but I think it's really important from a brain health
It's
standpoint.
so powerful though. I mean, if you think about like big leaders, they have visions, their dreams to try to make it
Yeah.
happen. One of the things I heard is like there's a reward. So I'm thinking like, how do we make self-reflection rewarding?
Yeah.
Maybe you're onto something.
I'm yeah, gonna steal my daughter actually loves that mindful monkey class.
Oh,
School. So I'm like, oh, maybe you should steal some of these ideas for adults too.
you know what? Why not? Most definitely. I mean, in the work that I do, I find that doing simulations is ever so essential for, and that's role plays right there, youth love to do role plays all the time, and
Yeah.
but how often do you get to do it in an adult context? So, I mean, unless you happen to like go out of your way, be like, oh, I'm going to be part of a theater group or something, try out
Mhm.
for something. You're probably
Yeah.
not going to have an opportunity to like play pretend. Although sometimes it feels on an everyday basis as we tend to code switch from different things we do.
Totally, totally fine right now. No, it's and imagination is a huge like that is a big activity. Like you're engaging so much of your brain. So maybe that is maybe everyone should sign up for the acting class that they don't want to sign up for, and like and start engaging those parts of their brain so that they can reflect and engage it a little bit. I truly see the brain as a muscle. Like I visualize it as a muscle. And like, okay, if I'm working out my imagination, I'm like getting some dopamine responses.
Yeah,
Like we're truly changing it. So yeah.
I love that. I wonder if, where can people learn more about your work or connect with you? If you want to talk a little bit more about your business too. I know you've talked a little bit about it, but I imagine there's a lot more the wonderful things that you're doing. So,
So my clinical practice is at Balance Brains. We're a small kind of integrative functional medicine brain health clinic. So focusing on the brain for multi different modalities. So if you want to learn more, if you're doing that self awareness and you're thinking like, actually, I do need some support, that's where I think we really come into play. And we have a website, balancebrainhawaii.com. I'm also for UH students. You can search me on campus email and you're welcome to reach out to me at Courtnee@hawaii.edu. Yeah, I would love to hear kind of feedback or different perspectives from people.
well, thank you so much, Courtney, for sharing your time, your insights, your deep commitment to healing, not just the individual level, but across systems, generations, communities. Yeah, thank you. Just today's conversation really reminded uh, about it's not just about um, figuring out how to resolve the conflict. It's about, how do we tend to the wounds, really, within ourselves and supporting others on their path to healing. How do we, when we understand trauma, honor the nervous system, create space for safety and connection, can we possibly open the door to deeper empathy, compassion, sustainable peace? Yes, I will put in the information about Balanced Brain in the summary so folks can definitely learn more about it. It is also for folks, balancedbrainhawaii.com. They can get more information there. And thank you so much for greatly appreciate you being here. And until next time, everyone who's listening, stay curious, stay compassionate, and continue to work for peace, one breath, one moment, one connection at a time. Thanks for listening.